Tonight, before this broadcast is over, someone in America will die of an opioid overdose. It happens every 18 minutes. In just 1 year, more than 29,000 people lost their lives to an overdose of heroin or prescription painkillers, including OxyContin, hydrocodone, and fentanyl. That's an increase of 329% since the start of this century. Because this has become a national epidemic, we're beginning special coverage tonight, and we'll start with Dean Reynolds.
I think he's coming around a little bit.
The frightening rates of overdoses are fueled by a mix of heroin and an opioid called fentanyl, 30 to 50 times as powerful as heroin itself.
There's this misperception that heroin laced with fentanyl is the better high. Conversely, it causes too many deaths.
One person dies every day from an overdose in Chicago, where Dennis Wichern is with the Drug Enforcement Agency.
When they take heroin laced with fentanyl, the purity goes way up and it just overtaxes their body, and that's where you get the overdoses and the deaths.
Put your legs down straight.
25-year-old Chelsea Blackburn of Pittsburgh, who was on heroin when she got pregnant but is now clean, said the search for a high can quickly reach a dead end.
I started on opiates like pain pills, and then by 19 I was like a full-blown heroin addict.
Overdose deaths are highest in West Virginia, New Mexico, New Hampshire, Kentucky, and Ohio, where in 2013 there were 84 fentanyl and heroin-related deaths, but a year later there were 503. Last month, a surveillance camera captured a drug user collapsing at a Cleveland area restaurant, falling into unconsciousness and then being revived by an antidote called Narcan. Now, in Ohio's 15 most hard-hit counties, relatives of drug users are being urged to get Narcan, or naloxone, as it's also called, to save lives. It can be obtained without a prescription. Dr. Mary DiOrio of the State Department of Health.
We have more unintentional drug overdoses in Ohio than accidental deaths due to motor vehicle accidents. And so it's a significant problem, and we want to do what we can to save lives, and this is one way we can do it.
The Obama administration has proposed a $1 billion plan to fight the opioid and heroin epidemic, Scott, but Congress has yet to appropriate the money.
Dean Reynolds with our overview tonight. Thank you, Dean.